Hi, I'm Ed Chadd, as Dr. Siegel and Dr. Irani mentioned, and I also would like to thank everyone for coming this morning, and thanks to Dr. Siegel and the MS team for inviting me to be a part of the conference. I'm honored to be here. As was mentioned, I'm a physical medicine and rehabilitation doctor, and my role on the MS team is to help address the variety of functional impairments that can accompany the disease. So not as much the medication end of things or the testing end of things, but addressing the actual functions. And my initial involvement in someone's care may be for a specific issue, like talking about a brace for foot drop or spasticity management, but my true passion is talking with patients, families, caregivers, to try to figure out ways for all people to remain active and enjoy the physical and emotional benefits of exercise, physical activity, regardless of someone's neurologic status. So to that end, I'd like to talk with you this morning about the use of aquatic therapy or water exercise in multiple sclerosis. And some of you may have heard me talk about this a bit in clinic with you, so I'd like to take this opportunity to dive a little bit deeper into the how and why of this type of therapy. So I'd like to start with a little historical background. Warm Springs, Georgia, 1924. This was a height of a polio epidemic in the US. And to review, polio is a virus that attacks the motor neurons in the spinal cord, results in flaccid paralysis of voluntary skeletal muscle, the arms, the legs, the diaphragm. And it was found that pool therapy allowed patients to exercise their weakened, paralyzed limbs in ways not possible on land. And you may recognize this gentleman here, Franklin Delano Roosevelt, who underwent therapy for polio in Warm Springs, Georgia. And this epidemic in the early 20th century and FDR's involvement led to the popularization of aquatic therapy for treatment in a variety of neurologic diagnoses. But before I get into the potential benefits of this therapy, I want to be upfront and talking about some of the precautions for the use of water therapy in multiple sclerosis. I certainly get a lot of feedback from patients about some of the challenges that they've faced with this. So the first thing I'd like to mention is the water temperature. Now, as many of you may experience, heat intolerance is a significant issue in MS, and the most common use of water therapy for rehab is probably for orthopedic rehab after joint replacement, for instance. And the water temperature for that tends to be much warmer than many people with MS can tolerate. Up to 98 degrees for joint replacement therapy as compared to kind of recommended 80-degree range for MS. So the second thing, second precaution is that moving in water is much easier than moving on land, and this can often lead to people being over-aggressive initially in the water and doing much more than they realize they can do, leading to significant overexertion and fatigue. Now, the combination of these two issues, the water temperature, overexertion, can result in a temporary functional decline. Well, this can complicate the logistics of getting out of the pool, getting changed afterwards. So just as, if you occasionally need assistance with dressing, well, after pool therapy is probably going to be one of those times when you need more assistance. So by planning ahead, thinking through these barriers in your minds can really help be prepared to get the most out of this. One other precaution is that immersion in water leads to increased urine production. So again, plan ahead, make sure your bladder is empty before getting in the pool to avoid any urgency or incontinence issues. So how does water therapy offer benefits beyond land therapy? Well, these benefits primarily come from some unique physical properties of immersion in a liquid, namely buoyancy, drag force, and hydrostatic pressure. So I'll go through these a little bit one by one. Buoyancy is an upward force that acts on an object immersed in water, and this results in that object having less apparent weight when it's immersed in water than it does on land. The effect of this, if you're immersed in water up to the level of the belly button, you've essentially offloaded half your body weight. If you go a bit deeper up to the level of the sternum, you've offloaded 75% of your body weight. And the implications for this are now weakened muscles that may have difficulty moving you on land are able to move your body through the water in a more natural way. The second important property is drag force. Now this results from a combination of viscosity, or resistance to movement within a liquid, and turbulence, a turbulent flow that's produced as you pass through water. The combination of viscosity and the turbulence produce this drag force, a force that resists your forward movement through the water. Now importantly, that force increases as the square of the velocity of your movement through the water. So this makes water a very useful strengthening environment. The harder you push against the water, the faster you try to move through it, the more force it exerts back against you, and that's that necessary resistance force to build strength in muscles. The third property to touch on is hydrostatic pressure. This is water pressure increases the further you go below the surface of the water. Approximately for every foot below the surface of water, your body is being exposed to 22 millimeters mercury of pressure. So for instance, again, if you're standing in water and your feet on the bottom of the pool, say 4 feet deep, you'll be exposed to 88 millimeters mercury of pressure. Now that water pressure increases as you, or I'm sorry, that water pressure decreases as you move up your body closer to the surface of the water. So the effect is a gradient force acting on your legs, which essentially can help push fluid up, down from your feet, from your ankles, where swelling is a common issue, and mobilize that fluid back into circulation. For comparison, there's a product we use a lot of, compression stockings for swelling, for edema, and the pressure from those stockings is 30 millimeters of mercury at the toes, going up to 20 millimeters of mercury up by the knees. So you can see that the water pressure is a bit bigger than that. So these physical properties of water, of immersion in water, can result in beneficial effects on neurologic, musculoskeletal, cardiovascular system especially. I'm going to leave that aside, but that's a large body of research on the effects on cardiac function primarily. But in MS specifically, issues like spasticity, strengthening, balance, gait, cardiovascular, back pain, another common use of water therapy, and edema management like I described. So I'd like to briefly go through a few of these in a little bit more detail, present just a little bit of the studies that have been done looking at these effects. Now most of the the scientific studies looking at water therapy and MS in particular are pretty small scale, almost more of a proof of concept studies rather than something I would call definitive on the order of 1,600 patients in a drug study. You'll see these are much smaller scale. But the first issue I wanted to talk about is spasticity. Now, something that's very common in multiple sclerosis, and as some of you may have heard me talk about in clinic, really the first line management for spastic muscles is stretching those muscles. Before medications, before injections, a good range of motion stretching program is necessary. Now the effectiveness of stretching can be amplified in water by offloading those muscles, offloading the joints that the muscles are acting on, allow the muscles to more completely relax and get more range of motion out of them. And then also the warmth of the water directly can help muscles relax too, like being in a hot tub. So there was a study last year out of Spain that took MS patients, divided into two groups. One group did Tai Chi type of exercises in the water. The other group did these similar exercises on land, and they looked at the resulting effects on their spasticity. Now, one thing I'd like to highlight in this study, which I'll touch on a bit more, is water therapy can be used fairly broadly in MS. The patients in this study went up to an EDSS score. Dr. Mayo-Dreyer had mentioned that scale, a score of function, an EDSS score of 7.5, which translates to patients who primarily use a wheelchair for mobility and maybe only stand to transfer in and out of the chair. So these are people with significant impairments. Now the results of this study showed that after a 20-week program, the patients in the water group had improved spasticity scores, and that benefit continued to last for up to a month after ending the exercise program. A couple months down the road, though, they were more back to the comparison level of the patients from the land therapy groups. I touched a little bit on how the drag force provides resistance to muscles for strengthening, and this is something that's been looked at fairly extensively in the joint replacement literature, as I mentioned. But in multiple sclerosis, I believe water therapy has excellent potential, especially for effects on muscles which may be so weakened that on land they're not able to fully move against the effects of gravity. For instance, the hip flexor muscles. I'll just try to shout a little bit here. So hip flexor muscles are very commonly quite weak with multiple sclerosis, and someone may have enough strength to swing their leg forward to ambulate, to walk, but not necessarily enough to raise the leg up fully through its range of motion, climbing stairs, for instance. Well, with immersion in water and offloading that body weight, now this weakened hip flexor muscle, which on land can only raise up this far, can now raise all the way up. And then, so once you have that full range of motion, you can build on strengthening through that range of motion. So there is a pretty old study at this point, 1984, very small again, 10 patients, but looked at a 10-week program of water calisthenics, water aerobics type of activities, swimming as well. Swimming is a somewhat separate topic, but this study showed improved knee extension and knee flexion strength, increased work capacity in the lower extremities, decreased fatigue or improved endurance in those muscles as well. Next issue I'd like to talk about a bit is balance in multiple sclerosis. Now, balance is commonly impaired. Balance is a very complex neuromuscular task, involves the integration of sensory input, not only from your inner ears that we think about a lot for balance, kind of telling you where your head is oriented in space, but also, again, the sensory input from your lower extremities, from your feet, telling you, is my body weight on the inside of the foot, the outside of the foot, and then coordinating that input with the motor output to contract your ankle muscles, contract your hip muscles, to keep your center of gravity over your feet and keep you stable. Well, with immersion in water, this balance training can be augmented through increased sensory input against the skin, against the muscles as your body's moving, and the buoyancy in water, that offloading of body weight, can significantly decrease someone's fear of falling. That's something you hear about a lot or read about a lot. Knowing that as compared to on land, if you're in water, you're not going to fall and break a hip or have other complications, can allow people to push through balance type of exercises that they might not otherwise be able to do on land. There's a study out of Korea, not multiple sclerosis patients, but stroke patients. A lot of similar neurologic impairments can be shared by those two diagnoses, so I chose to include it here. but looked at an 8-week, again, Tai Chi water exercises compared to land-based gym exercises, and showed significant improvements for the water group on some of our standard balance scores, this Berg balance scale, the ability to shift their weight back and forth on the limb that was affected by their stroke. Maybe I'll save talking about Tai Chi for next year, but you might notice a trend of how that comes up in a few of these different studies. The last impairment that I'd like to touch on is gait. So kind of the ultimate endpoint when we come to measuring function. Now, multiple sclerosis can cause gait problems by a variety of mechanisms. Cause muscles to be weak, spasticity, that involuntary muscle contraction can interfere with your gait pattern, and perhaps most importantly, an impaired motor sequencing, or the idea that there's a central pattern generator in our nervous systems which kind of controls the coordinated muscle activation patterns that allow you to walk smoothly and naturally without thinking about it, and that may be affected in MS. Well, there's actually a specific type of water therapy that was developed in Europe, this Bad-Ragaz ring method that's focused on producing these coordinated muscle activation patterns for re-education of that pattern generator, if you will. Now, there was an interesting study, interesting to me, again, small scale, from Long Island in 2011, that again included patients from a fairly broad spectrum of impairment or spectrum of ability, independent ambulators up to people primarily using wheelchairs. And I appreciated that the authors commented in this study that the majority of the participants used accessorized transportation to attend the training session. So a little plug for public disability transportation there. So this was a 5-week program, and they found an average increased gait speed of 20% at the conclusion of this community water therapy program. And 20% may not sound like a home run, but if you compare that to the drug studies that led to the approval of Ampura for walking and MS, as Dr. Mayo-Dreyer mentioned, in those studies, actually only 43% of patients who took the drug responded to it, and of people who responded to it, the average gait increase was about 25%. So, you know, that does show that this water therapy potentially could have some significant benefit. So, as I mentioned at the start, you know, I believe that there is a type of physical activity out there that anyone can participate in regardless of their neurologic status, and water therapy is one example of this. Whether, you know, someone is a independent ambulator with no assistive device, who may be, you know, a good candidate to do more of an independent water therapy program in a community pool, a water aerobics class, that sort of thing. Or if somebody has more impairment, wheelchair user, for instance, it might benefit from a more one-on-one environment with a therapist in a pool. Then there's a variety of therapy facilities that offer aquatic therapy, certainly in the Southeast Michigan area here. And then often transitioning from that formal one-on-one program to a continuing independent program. In conclusion, you know, I encourage everyone to think about, hey, is this a type of exercise that I may be interested in that could work for me? And, you know, I did mention there can be some pretty significant barriers to participation in it, but with some planning, with some preparation ahead of time, with, you know, talking with your doctor, oftentimes those barriers can be removed. So I'd like to thank you all for your attention, and it's been a pleasure to speak to you.
Well, I'd like to thank all the speakers from this morning. I think they were 4 informative talks. I hope you enjoyed them. So now we're going to take a 10-minute break. When we return, I'm going to introduce you to our research team, and they're going to discuss some of the exciting progress that they're making, and then we're going to have the question and answer session. So if you would, please submit your index cards to one of us or at the registration desk with your questions, and we'll see you back in 10 minutes.